A lot of people assume that taking a simple over-the-counter pain pill is one of the safest things you can do. It is sitting in your medicine cabinet right now. You have taken it for headaches, for arthritis, for that stiffness in your lower back that greets you every single morning. Your doctor never warned you. The label says it is safe. Millions of people over 60 take it every single day without a second thought. But here is the truth. The truth most doctors do not take the time to sit down and explain to you. That one pill, the one millions of seniors trust more than almost any other medication on the planet, is quietly inflicting serious and compounding damage on the organ responsible for keeping you alive, your liver, and it is doing it slowly, silently, without a single symptom until the damage becomes extremely difficult or even impossible to reverse. According to the American Journal of Gastroenterology, acetaminophen, the active ingredient in the most popular pain reliever in the world, is the #1 cause of acute liver failure in the United States. Not alcohol, not hepatitis, not prescription drugs, a pill you can buy without a prescription at any gas station in the country. And here is the most frightening part. The majority of those liver failure cases were not from people who took too many pills on purpose. They were from people who followed the directions on the bottle and still got hurt. So here is the question I hear almost every single week in my clinic. If this pill is so dangerous, why does nobody tell us? That is exactly what we are going to answer in the next 20 minutes. And the #1 reason on this list, the one that shocks nearly every patient I share it with, is something you are almost certainly doing right now without realizing the harm it is causing. If you are over 60, this message could literally save your life. My name is Dr. Mitchell. I have spent over 2 decades in internal medicine and hepatology, specializing in liver health in adults over 55. I have seen too many patients sitting across from me asking why nobody warned them sooner. What I am about to share contradicts what most doctors will tell you in a 10-minute appointment. Every week, I share life-saving health information explained clearly for adults over 60. If you have not already, subscribe now. What we are about to cover is exactly why this channel exists. Here is something most people do not realize. Your liver is actually at its most vulnerable not when you are drinking alcohol or eating processed food. It is most vulnerable when you are taking what you believe is a completely safe, everyday medication. Not during a medical crisis, not during a hospital stay, during the quiet routine moments you assume are perfectly harmless. During the hours after you swallow that pill, your liver is working harder than almost any other organ in your body to process it. And after age 60, your liver's ability to do that job declines significantly every single year. This damage does not announce itself. It builds for weeks, for months, for years. And by the time you feel something wrong enough to go to a doctor, in the overwhelming majority of cases, the liver has already lost a significant portion of its function. The 5-year survival rate for advanced liver failure is below 30%. That number alone is why everything I am about to show you matters so much. And here is what terrifies me most as a doctor. At least 3 of the habits I am about to describe are things you probably did this week, maybe even today. And the 4th one on this list carries not 1, but 2 completely separate dangers happening simultaneously inside your body. Now let us begin with the 5th way this common pill is destroying your liver. And this is where most people first begin to understand the true scope of the danger. The hidden daily overdose. Many people do not think they are overdosing. They think, I only take the recommended dose. But here is what most people miss entirely. Acetaminophen is not just in your pain reliever. It is hidden inside cold medicines, sleep aids, allergy pills, flu remedies, and even prescription medications your own doctor gave you. You could be taking 2 or 3 separate products every single day that all contain acetaminophen without having any idea. That means you are stacking doses on top of each other without knowing it. Here is what is happening inside your body when this occurs. When acetaminophen is processed by your liver, a small amount of it gets converted into a highly toxic byproduct called NAPQI. At normal doses, your liver neutralizes NAPQI easily using a powerful natural antioxidant called glutathione. But when you exceed the safe daily threshold, even by a small margin, your glutathione reserves run dry, and without that protection, NAPQI begins attacking and killing liver cells directly. A study published in the journal Hepatology followed over 12,000 adults over the age of 55 for 3 years. The results were deeply disturbing. Adults who unknowingly exceeded the daily acetaminophen limit by combining multiple medications had a 48% higher rate of elevated liver enzymes. Elevated liver enzymes are the very first measurable sign that liver cells are being damaged and destroyed. Think of your liver like a water filter in your kitchen sink. Every single day, it filters out toxins and keeps the clean water flowing through your body. But if you run contaminated water through it at 3 times the normal speed, that filter clogs. It does not break with a loud snap. It just slowly, quietly stops working. And by the time you notice the water tastes different, the filter is already ruined. That is exactly what acetaminophen overload does to your liver. I once treated a 71-year-old man who came to me with severe fatigue and yellowing skin. He was shocked when I told him his liver was failing. He looked at me and said, "Doctor, I do not drink. I eat well. I exercise. How is this possible?" When we carefully reviewed every medication in his cabinet, he was taking a pain reliever for his knees in the morning, a nighttime cold medicine for his allergies, and a prescription combination drug for his back. All 3 contained acetaminophen. He had been unknowingly consuming nearly double the safe daily dose every single day for over 2 years. How many medications in your cabinet right now contain acetaminophen? Go check after this video. Write the real number in the comments below, because that number tells you exactly how much hidden risk you have been quietly accepting without knowing it. The good news is this. Fixing this starts with one powerful but simple step. Read every label. Look for the word acetaminophen or the abbreviation APAP on every single medication you take. Add up the total milligrams per day. For adults over 65, most liver specialists now recommend staying below 2,000 milligrams daily, not the 4,000 listed on most labels. Talk to your doctor about pain alternatives that do not rely on acetaminophen at all. Now, as serious as that hidden overdose is, the next one is even more dangerous, because it involves something millions of seniors do every single morning that directly weakens the liver's only defense system. Let us move to the 4th way this pill destroys your liver: taking it on an empty stomach. Most people take their morning pain pill with a cup of coffee or nothing at all. They do not eat breakfast first. It seems completely harmless. But after age 60, this single habit changes how your liver processes the drug in a way that dramatically increases its toxicity. And here is what most people do not realize. When your stomach is empty, acetaminophen is absorbed into your bloodstream much faster than normal. It floods your liver with a concentrated dose all at once instead of spreading it out gradually. Your liver's detoxification system, which depends entirely on glutathione, gets overwhelmed because it cannot produce enough protection fast enough to keep up. A major research study published in the Lancet Gastroenterology and Hepatology examined fasting versus fed states in older adults taking standard doses of acetaminophen. The findings were striking. Participants who took the drug on an empty stomach showed a 37% higher concentration of the toxic metabolite NAPQI in their blood compared to those who ate a meal first. Think of it like pouring an entire bucket of water onto a small sponge at once versus slowly dripping water onto that same sponge over the course of an hour. The sponge is the same size either way, but one method overwhelms it instantly and the water runs right off. Your liver is that sponge, and every morning you swallow that pill without food, you are dumping a bucket on it. I once treated a 66-year-old woman who had taken her arthritis medication first thing every morning for years on an empty stomach. She came to me with unexplained nausea, loss of appetite, and a dull ache on her right side underneath her ribs. Her blood work revealed significantly elevated liver enzymes. She had absolutely no idea that skipping breakfast before her pill was the trigger behind all of her symptoms. Once she changed that single habit and began eating a small meal before taking her medication, her liver markers returned to normal within 8 weeks. One simple change made all the difference. If you are over 65, this is critical for you. Always eat something before taking acetaminophen. Even a small meal, a piece of toast, a banana, or a handful of crackers gives your liver the buffer it desperately needs to process the drug safely. But here is the part that surprises almost everyone. The third way this pill destroys your liver has nothing to do with how much you take or when you take it. It has everything to do with something most seniors drink every single day without thinking twice. The third danger: mixing acetaminophen with alcohol, even small amounts. A lot of people think this warning only applies to heavy drinkers. That is dangerously and completely wrong. If you are over 60 and you have even one glass of wine with dinner and then take a pain pill before bed, you are creating a chemical reaction inside your liver that can cause catastrophic, irreversible damage. Here is what is happening inside your body when you combine these two substances. Alcohol and acetaminophen are both processed by the same enzyme system in your liver called the cytochrome P450 pathway. When alcohol is present, this system actually produces more of the toxic byproduct NAPQI from acetaminophen, not less, more. At the same time, alcohol actively depletes your glutathione reserves, so you end up with significantly more toxin and significantly less protection at the exact same moment. Research published in the Journal of the American Medical Association followed over 8,000 adults aged 60 and older for 4 years. Those who consumed even moderate amounts of alcohol, defined as just 1 to 2 drinks per day, while regularly taking acetaminophen, had a 350% higher risk of liver toxicity compared to those who took the same medication without any alcohol. Imagine your liver as a firefighter trapped inside a burning building. Acetaminophen starts the fire. Glutathione is the water supply. Now imagine someone locks the exits and cuts the water line. That is exactly what alcohol does. It traps the fire inside your liver and takes away the only thing that could extinguish it. I once treated a 74-year-old woman who enjoyed one small glass of red wine with dinner every evening. She also took 2 acetaminophen tablets before bed for her joint pain. She had done this for years and felt perfectly fine. She came to me only because her annual blood work showed her liver enzymes had tripled in just 6 months. She looked at me and said, "But doctor, I barely drink." That one glass, combined with that one pill, night after night, was more than enough. We stopped the acetaminophen immediately, and her liver slowly recovered over the next several months, but she was just weeks away from serious, lasting damage that could not have been reversed. If you drink any amount of alcohol, even occasionally, even 1 glass a week, tell your doctor before taking acetaminophen regularly. There are safer alternatives for pain management that do not compete with alcohol for your liver's resources. Now, the second way this pill destroys your liver is one that even many doctors overlook entirely, and it has to do with something that changes inside every single person's body after the age of 60, whether they realize it or not. The second danger: age-related liver decline. Your liver at 60 is not your liver at 40. Many people assume their liver works the same way it always has. They take the same dose they took at age 45 and expect the same result. But here is the reality. Your liver has been quietly shrinking. After age 60, the liver loses roughly 6 to 8% of its total volume per decade. Blood flow to the liver decreases by up to 40% compared to younger adults. The critical enzymes responsible for breaking down and metabolizing drugs become slower, weaker, and less efficient with every passing year. A comprehensive study published in the British Journal of Clinical Pharmacology measured drug metabolism rates in adults ranging from age 30 to 85. The findings were remarkable and alarming. Adults over 65 metabolized acetaminophen up to 30% more slowly than younger adults taking the exact same dose. That means the drug stays in your system much longer than intended. It lingers in your bloodstream. And the longer it lingers, the more NAPQI quietly accumulates and damages liver tissue. Think of your liver like an old furnace in your basement. When it was brand new, it burned fuel quickly, cleanly, and efficiently. But after decades of constant use, it runs slower. It does not burn as hot. Residue and ash build up inside. If you keep feeding it the same amount of fuel as when it was new, you are overloading a system that simply can no longer keep up with the demand. I treated a 68-year-old man who had been taking the same standard 2-pill dose of acetaminophen every morning for over 15 years. He felt perfectly fine until he started experiencing dark-colored urine and constant, unexplained fatigue. A liver imaging scan revealed early-stage fibrosis. Fibrosis means scarring of the liver tissue. His liver had been silently struggling to process the drug at a rate it could no longer safely handle. We reduced his dose immediately and added liver protective nutrients to his daily plan. Within 4 months, his liver function tests improved significantly. But those years of accumulated damage could have been entirely prevented with one conversation. If you are over 60, ask your doctor whether your current acetaminophen dose is still appropriate for your body at your age right now. The dose that was perfectly safe at 40 may be quietly causing harm at 67, and now, the number one way this common pill destroys your liver. This is the one I mentioned at the very beginning of this video, the one that shocks nearly every patient I share it with. And it is something you are almost certainly doing right now without any awareness of the consequences. Number 1. Long-term daily use. The slow, silent accumulation of damage that nobody talks about. Most people understand that a massive overdose of acetaminophen can destroy the liver in a matter of hours. That kind of event makes national headlines. What does not make headlines is what happens when you take a perfectly standard dose every single day for months or years on end. Because the damage from long-term chronic use is not sudden, it is not dramatic, it is incremental, it is invisible, and it is devastating. Here is the mechanism that makes this so dangerous. Every single day you take acetaminophen, a small amount of NAPQI escapes your liver's defenses and causes microscopic damage. Your glutathione reserves regenerate overnight, but they never fully recover to where they were the day before. Over time, you create a growing deficit. Your liver cells absorb microdamage day after day that accumulates exactly like tiny scratches on a windshield. One scratch is completely invisible, 10 scratches are nothing, but 1,000 scratches make it impossible to see the road ahead. A landmark study published in the Journal of the American Medical Association followed over 25,000 adults over the age of 60 for 5 years. The results stopped me in my tracks when I first read them. Adults who took acetaminophen at the recommended daily dose for more than one continuous year had a 220% higher risk of developing abnormal liver function compared to those who used it only occasionally. 220%. From a dose, the label explicitly says, is safe. Think of your liver cells as bricks in a load-bearing wall. Each day of acetaminophen use quietly removes one brick. You do not notice the first brick missing. You do not notice the 10th. But after a full year, there are visible gaps in the structure. After 3 years, the wall's integrity is seriously compromised. After 5 years, the wall can collapse from a routine stress that it should have handled easily. I once treated a 72-year-old woman who had taken 2 acetaminophen tablets every single morning for 6 consecutive years. Her reason was heartbreakingly simple. Her knees hurt when she woke up, and those 2 pills helped her start her day. She never once took more than the recommended dose, not a single time. When she came to me with unexplained swelling in her legs and fluid accumulation in her abdomen, her blood work revealed advanced liver disease. She looked at me with tears streaming down her face and said, "But I did everything right. I followed the label." She did follow the label. every single day. The problem is that the label was never designed for someone who would take it every day for 6 years straight. If you have been taking this medication daily for more than a few weeks, please, I am asking you directly, bring this up with your doctor at your very next appointment. Write, "I am asking my doctor" in the comments below right now, because making that one simple phone call could change the entire course of your health. The good news is this: your liver is one of the most remarkably resilient organs in the entire human body. It can regenerate damaged tissue, it can heal itself, but only if you give it the opportunity before the damage becomes permanent. Reducing unnecessary acetaminophen use, exploring safer pain alternatives with your doctor, and supporting your liver with proper nutrition and hydration can reverse much of the early damage. The critical key is taking action now, not next month, not next year. Now. Now, before we wrap up, there are 5 rules I need you to hear. Because without these 5 rules, you could follow everything else on this list perfectly and still not get the full benefit. Rule 1. Never take acetaminophen without reading every single label first. Many combination medications contain it under different brand names. If you are taking more than one product, add up the total daily milligrams from all sources. This single step alone prevents the #1 cause of accidental liver damage in seniors. Rule 2. Always eat something before taking your dose. Even a small amount of food fundamentally changes how quickly the drug hits your liver. An empty stomach turns what should be a manageable dose into a dangerous flood of toxicity. A piece of toast, a banana, a few crackers, that small effort protects you enormously. Rule 3. If you drink any alcohol at all, even 1 glass per week, talk to your doctor about switching to a completely different type of pain reliever. Acetaminophen and alcohol together create a toxic combination that your aging liver simply cannot safely manage. This is not a gray area. This is a firm medical recommendation. Rule 4. Ask your doctor to test your liver function at least once per year. A simple blood test called a liver panel can detect damage months or even years before you ever feel a single symptom. This test costs almost nothing and takes 5 minutes. Do not wait for symptoms. By the time they appear, you have already lost valuable ground that is extremely hard to recover. Rule 5. Never assume that over-the-counter means harmless. The most dangerous medications in all of medicine are not always the ones locked behind the pharmacy counter. They are the ones so common, so familiar, so trusted that nobody ever thinks to question them. Question everything that goes into your body after 60. Your liver depends on it. These are not optional lifestyle suggestions. Every single one of these mistakes quietly cancels the protection you are working so hard to build. Let us quickly summarize the 5 ways this common pill silently destroys your liver. 5. The hidden daily overdose from combining multiple medications. 4. Taking it on an empty stomach. 3. Mixing it with even small amounts of alcohol. 2. Age-related liver decline making your standard dose unsafe. 1. Long-term daily use and the slow, invisible accumulation of irreversible damage. Each one alone is dangerous. Together, they create a perfect storm. The truth is painful but empowering. Many cases of liver failure in adults over 60 are not fate. They are not bad luck. They are preventable. You do not need expensive treatments. You do not need extreme routines or radical changes. You need awareness and consistency. Your liver has been working for you in complete silence every single day of your life. It has filtered every toxin you have ever been exposed to. It has processed every medication, every meal, every glass of water. It has protected you from dangers you never even knew existed, never once asking for anything in return. Never once complaining. Never once slowing down until it physically could not continue. It has been your most loyal, most tireless, most silent defender for 60, 70, 80 years. Start giving something back. Start protecting the organ that has spent your entire life protecting you. Before you leave, I ask you to do 4 important things. First, subscribe to this channel. Every week, I share life-saving health information explained clearly for adults over 60. Second, like this video. It helps this message reach others who may not know they are at risk right now. Third, leave a comment. Write, "I am checking my labels tonight." Your commitment written down in public may inspire someone else watching to do the exact same thing. And finally, share this video with someone you care about, a partner, a parent, a friend, a neighbor. You may never know whose liver you help protect with one simple share. This is Dr. Mitchell. Take care of your liver. It is the one organ you truly cannot live without, and it has been silently taking care of you for your entire life. I will see you in the next video.